Bangladesh has recorded 53 deaths in the last 24 hours from COVID-19 infections, the highest number of deaths recorded in the country on a single day. At the same time, the country also recorded the highest 3,862 new cases in the last 24 hours. DGH's Additional Director, General Administration, Professor Nasima Sultana, revealed the latest figures in a daily online bulletin on the COVID-19 pandemic on Tuesday.
গত 24 ঘন্টায় নমুনা সংগৃহীত হয়েছে 18,403টি
18,403 samples have been collected in last 24 hours. 17,214 have been tested in last 24 hours. In last 24 hours, 3,832 have been tested positive. Till now, 94,081 have been identified with COVID-19. In last 24 hours, 2,237 people have been recovered. Till now, 36,264 people have been recovered. 53 people died in last 24 hours. A total of 1,262 people have died so far.
এ পর্যন্ত 1,262 জন
Dhaka North City Corporation Mayor Atikul Islam has said it is not possible for the city corporation to implement the lockdown without specifying houses and areas. He said they would be able to implement the lockdown within 2 or 3 days of receiving such instructions from the health department.
The whole map will be in our hands. Then we will see it with our councillors and field level workers. I asked the health department to provide me the map immediately. They said they will provide me the map in a day or two. When we will get the map, we will start our work gradually.
Dhaka South City Corporation Mayor Sheikh Fazlinur Taposh has said the areas marked as red zones are not realistic. He said this at a briefing after the meeting on implementation of red zone at Nagar Bhavan in the afternoon. The mayor of the South said that the implementation of the lockdown will start in 2-3 days as soon as the specific zones and instructions given by the concerned authorities are received. The mayor said the lockdown would be implemented gradually by dividing it into smaller areas. He also said that free food will be provided to the poor in the red zone. Ambiguity has been created to implement lockdown by identifying the red zone. Although there has been a lockdown in some parts of the country, State Minister for Public Administration Farhad Hussain has said that even if the red zone is identified, it is not final yet. It will take more time to implement. Local Government Minister Tajul Islam said the Health Ministry will decide when some areas will be locked down. Meanwhile, Army patrols are being intensified in the red zones to comply with government directives. The Inter-Services Public Relations Directorate (ISPR) said yesterday, considering the corona infection, the Cabinet Division issued a notification extending the general holiday in the red zone till June 30. And in the notification about yellow and green zones, it is said that in the two zones, everything will be open to a limited scale. Public and private offices will also be limited till June 30. At the same time, public transport will run in compliance with the health rules.
When the red zone will be identified, it is the health official in that area will give first advice to the administrative officials, and then public administration will seek permission from health department. The small area, which is manageable, will be identified first. It will take 3 or 4 days to take preparation if we identify our area as a red zone today. The general holiday will be implemented in those areas.
এটি শুধু রেড জোনের জন্য। রেড জোন কিন্তু আমরা একই সাথে সব এলাকায় রেড জোন হবে না।
লকডাউনের ব্যাপারে সিদ্ধান্ত স্বাস্থ্য মন্ত্রণালয় থেকে আসে।
Health Ministry also knows the density of any area. If the ministry direct to impose lockdown to any area, our city corporation officials will work on it.
So far, 13 judges and 26 staff across the country have been infected with the coronavirus while conducting and administering justice in the virtual court system. Besides, 4 more judges are in isolation with symptoms. Judge Firdaus Ahmed of the Lalmonirhat Women and Child Abuse Suppression Tribunal is currently undergoing treatment at the ICU of Dhaka CMH. The remaining 9 judges are undergoing treatment at their homes. Chief Justice Said Mahmood Hussain is keeping a close watch on the affected judges. The Chief Justice has requested the concerned district judges to take necessary steps for the treatment of 26 employees. A 5-member committee headed by the Registrar General of the Supreme Court has been set up to keep in touch with the victims. Another 5-member committee is in charge of medical matters. Health workers in Bangladesh have a higher rate of coronavirus infection than any other country in the world. Globally, the rate is 2.5%, but 4% of the total identified patients in the country are doctors, nurses, and medical technologists. The death rate is also worrying. Stakeholders are blaming poor ICU, lack of safety equipment, and lack of training. Coronavirus infections are on the rise among health workers, including doctors. According to the Bangladesh Medical Association, 1,048 physicians and 143 medical technologists were infected within 100 days of infection. According to the Bangladesh Nurses Association, 1,040 nurses are affected. In all, more than 3,600 health workers are affected, which is 4% of the total. This rate is the highest in the world. Hopefully, more than half of the health workers, including the infected doctors, have recovered and joined the work. Flight operations on international routes from Bangladesh resumed in limited scale in compliance with the health safety guidelines regulations. Passengers are being kept in institutional quarantine. Passenger flights to and from all countries except the United Kingdom, China, Hong Kong, and Thailand were suspended from March 21 to 31 to prevent coronavirus infection. In another order, flights to all countries except China were banned until April 6. The ban was later extended to June 15 in conjunction with the general holiday. Earlier flights on domestic routes have been operating in compliance with hygiene rules since June 1. Former director of Sohrawardi Medical and Medicine expert Professor Mujibur Rahman has died of corona. He died at Dhaka CMH at 5:30 am. His corona came positive 3 weeks ago. The Bangladesh Medical Association BMA has said 1,011 doctors across the country have been infected with corona so far. 1,331 technologists, including health workers, have been affected. In the other hand, the Bangladesh Nurses Association said that 1,160 nurses have been infected across the country. In all, a total of 3,502 health workers, including doctors, nurses, and technologists, have been infected. More than 40 people have died so far. Bangladesh has improved 4 steps in the World Peace Index 2020 published by the Institute for Economic and Peace IP, an international research institute based in Australia. With a GPI score of 2.121, Bangladesh ranks 97 out of 163 countries in the world. In 2019, Bangladesh was 101 in this index. Bangladesh has improved the most in South Asia in the Peace Index last year. In the overall score, Bangladesh has improved by 2.3%, which is the highest in South Asia. Bangladesh has improved in all 3 domains of indexing. Especially in safety and security, Bangladesh ranks 4th in South Asia in the index. Bhutan is at the top as usual. Nepal and Sri Lanka are in 2nd and 3rd place. India, Pakistan, and Afghanistan are in 5th, 6th, and 7th place among the countries in the region.